The National Academies of Sciences, Engineering, and Medicine has finally given long COVID a universal definition. More than 1,300 experts and researchers contributed to the new definition, which says long COVID is a, quote, infectious associated chronic condition that occurs after a COVID-19 infection and is present for at least 3 months as a continuous, relapsing, and remitting or progressive disease state that affects one or more organ systems. The CDC has accepted this definition. For more, let's bring in infectious disease Dr. Amesh Adalja. He's a senior scholar at Johns Hopkins Center for Health Security. Haven't spoke to you in a while, but it's good to see you again. And actually, let me just start with that, Doctor. I think a lot of people, this is just anecdotal, but a lot of people out there are saying, I'm done talking about COVID. They don't want to think about it anymore because those years were so rough. Why do you think it's important to remember?
It's important to remember because COVID didn't evaporate. It's still one of our endemic respiratory viruses that's going to continue to infect people, hospitalize people, and even kill people. Even though the bad days of hospitals under crisis is over, this is still going to be a chronic problem, especially because of long COVID. This is kind of one of the long cascading tails to this pandemic. And the other thing is that we need to keep remembering all the mistakes of COVID-19 because we certainly are going to face other infectious disease emergencies in the future.
I gave this sort of long official definition of what they've agreed now long COVID is. Can you put it into simpler terms? What is long COVID?
Long COVID is a condition in which someone who's had COVID has recovered from the acute part of that infection. And now it's 3 months later, and they still have symptoms involving multiple different organ systems, including, for example, being short of breath, having cognitive difficulties, having fatigue, that have persisted past that 3-month window. And what this definition does is it really standardizes what people are talking about, because all of the early long COVID research have been plagued with different definitions, making it very hard to compare things in one study versus another study. And this clear definition kind of gives researchers a green light to start doing more rigorous work and being able to use all of the tools that medicine and biostatistics have to try and unravel the mysteries of this problem and give people some solutions.
Are there still a lot of problems out there with somebody coming to their doctor and saying, listen, I think I have long COVID, and the doctor isn't quite sure what to say or how to figure this out?
That's definitely the case because there's not some blood test that you can do. And long COVID symptoms are something that overlap with many other conditions. So a clinician faced with a patient with possible long COVID has to do a lot of work to really isolate what's causing those symptoms. Is it an undiagnosed other illness? Is it something that's completely not related to COVID, or is this long COVID? That, I think, is still going to take some time. But by having a definition like this, we can start to think about what types of tests, what type of diagnostic criteria can you use to rule other things out and rule long COVID in, and then that puts people on a path to the correct treatment. So it is still challenging because it is a nebulous term with lots of different symptoms that could be from many different causes. There's not one specific symptom from long COVID, and there's not one blood test you can do to confirm long COVID.
Doctor, we didn't talk about this before, and I apologize if you don't know the answer, but do we have any idea how many people suffer from long COVID?
It's in the tens of millions. Long COVID seemed to be much more common in the early days of the pandemic before the vaccine. People who were infected with the original version of this virus, those long COVID numbers are very high. It's become less and less, for example, with the Omicron variant and in individuals who have vaccination. But about 5 to 10% of people who get infected may have long COVID. And we know that this whole country was basically infected. So a percentage like 5 to 10% of a big number is a pretty big number. So this is one of the long tails of this pandemic, as I said.